Hello and welcome to another episode of What is IV Therapy. This is I think this is our part 3 of the series I started about 2 videos ago. And one thing I want to talk about, again, I'm picking my questions from questions that my clients ask me, because when you come into my spa, the IV Cafe, what we're asking you is a series of questions to see if you qualify. But a lot of times, sometimes when they come for some other services and then they inquire about the IV therapy and they're like, do I need it? Do you think, why, what is it? So, this is the thing, this is the difference between getting an IV therapy and ingesting something or ingesting vitamins and minerals orally. Now, a lot of times when you're taking your multivitamin, that's not, it's over the counter. It's not something that your doctor even prescribes for you. You can go ahead and just do what you want, all willy-nilly. However, with IV therapy, it's not so. There are a number of reasons why. For one thing, it is an invasive procedure, meaning we're going below the skin surface and we're going into your bloodstream, we're going into the vein. So, having said that, you need skilled professionals to be able to carry this service, okay? To be able to efficiently, safely, and effectively treat you in the proper way that it should be. Again, there are infection control, and it's a skilled process. So having said that, that's one of them. Now, again, IV therapy isn't for everyone, because people ask me that too. And they're like, oh, I want to get an IV therapy. Well, the one thing I do is you have to go through a set of screening questions, screen tool, which is pretty... It's not like math, okay? It's not brain surgery. We're just going to find out, as in any kind of treatment you're getting, really, asking you what your health history is, again, that will help the healthcare provider be able to make very, very adequate and important decisions to ascertain if you're a candidate for IV therapy. Most people are, but then there are people who have compromised circulatory problems, compromised, all the kind of situations. There's so many things that come to play. One thing I will tell you, one size doesn't fit all, okay? So what am I trying to say? What I'm saying is not all IVs, or not everyone qualify for all IVs, or not all IVs is for everybody. Does that make sense? There are people, say for instance, I'm just going to throw this out there, but then again, your healthcare provider actually is the one who will determine if you are qualified or not. So say, for instance, from my own nursing knowledge and working in the medical field with doctors and, clients over the years, if you have compromised circulatory problems, say, for instance, you have congestive heart failure, so that means you are on fluid restriction. Now, remember, with IV comes volume increase, right? So we are putting volume of liquid into you. That's not to say that everyone with CHF does not get IV. They just need to be monitored properly. As long as you've been cleared, then that would also inform the amount of liquid that you can get. So I just put that out there just to give you an example of what could, again, make one be it's not a definite no. It just means that you need more management, because after all, people with CHF do get IV if they need it to get their treatments to them. So I was just throwing that out there. Please, I'm not saying that people with CHF cannot get IV. So having said that, so who are the people, or why do you need IV? When would you need IV? So I do have a cheat list here, which I'm just going to go over. But I also want to say here, I think I already said that one size doesn't fit all. So you have to be mindful all IVs are not the same. A lot of times IVs are tailored to what your needs are, what your goals are, what you can or your body can accept. Okay, so we understand that. So going over my cheat sheets, I have individuals who are suffering or recovering from illness. So say, for instance, and I do get this, I have people coming into my facility wanting to boost their immune system and to speed up recovery. So these are candidates where IV is good for you. You find a lot of athletes who, and I think I've mentioned this in my previous videos, where athletes come in, you know, they've expended a lot of energy and they need to recover fast. Again, IV is the quickest way for them to recover. We also have individuals who have chronic low energy. There are just some people, for whatever reason, you know, their health status, they just run on low. IV therapy is a good treatment for you. You're a good candidate for it. We also have people with mood disorders such as depression and anxiety. Now, when we talk about IV therapy, remember, we're not just putting liquid in you. We are putting vitamins, minerals, and other types of medication that is needed to help boost your health or maintain you in that optimal homeostatic environment that we need your body to be in. So again, if you have seasonal depression and anxiety, you're a good candidate for it. And then I already mentioned athletes, you know, sometimes before major sporting activities, they want to be at a certain performance level. So they are also a good candidate. I want to add some caveat here. There are chronic conditions, or people who have chronic conditions, who also benefit from IV therapy, because sometimes when you increase this micronutrients in you, you find that it actually eradicates or helps you manage the symptoms of chronic conditions. So it's something we're going to explore further, but I don't want this video to be too long. I just wanted to come to you because that's one thing people always ask me. Do I qualify? Am I a candidate for it? So those are usually, you know, it's for immunity, it's for anti-aging, beauty, it is for mood disorders, you know, it's for hypertension, people with diabetes, chronic pain. A big one is partying people, jet lag, especially now after it's a new year, people coming back from, you know, the holidays, and or you do frequent traveling with your work. IV is great for you because it's all about that hydration, and not just hydration alone, but you're hydrating and getting the benefits of those micronutrients that actually keep you alive. Those micronutrients keep you alive. So you're not getting it enough in your food. You're not getting it enough even if you swallow pills. We already talked about in the last video, because there's a whole lot of wastage. So come back again. Let's talk about some more about IV therapy and have your questions answered. Again, feel free to leave comments down there in the comment section, and also you can reach me directly. My number is there, and I can answer your question even if you're not coming into my practice. I would answer your questions. So until I see you again, be safe, be kind.